please welcome Nanette COCERO, Regional President of Emerging Markets at Pfizer Innovative Health.
Okay. There you go. Whoa. All right. Good afternoon. There's a lot of people moving around. All right. Good afternoon. It is extremely energizing to be here this afternoon, sharing with you all a common objective, which is social good. Let me take a moment and take you through a couple of numbers. There are 7.5 billion people that live in our planet today. And 5.5 billion people live in emerging markets. 70% of the global population live in the emerging world. And the one thing that these people have in common is that they have very limited access to health care. To the high-quality health care that you and I take for granted, these people in emerging markets barely have access to it. Let's think about the millions of children that every day do not have access to the vaccines that will protect their lives. When we compare it to our world, the imbalance is unbelievable. Let's take, for example, the continent in Africa, where 25% of the global disease burden is in Africa, yet Africans have access to only 3% of the global healthcare workers and to only 1% of the finance resources. Medicines and treatments like the ones that all of us here in this room are accustomed to are basically not available to the large majority of the population in emerging markets. This is a very special week in New York. We're paying very close attention to the UN Sustainable Development Agenda. And for us at Pfizer, our focus is on goal number 3, to promote good health and well-being for all. For us at Pfizer, it's more than a target. It is part of our core values. My special area of concern is emerging markets. 2 years ago, Pfizer took on this challenge head-on, and we established an entirely new organization dedicated to looking for new approaches that will improve healthcare in emerging markets. Because the practices that are common in the Western world simply do not apply to the emerging world. I am very privileged to be leading this organization, where we are meeting many people that are looking to find innovative ways to improve healthcare. And I have met many people that have a deep understanding of the need in emerging markets, and people that are finding new approaches, innovative solutions that are improving healthcare in the emerging world. An example of a person that is very close to my heart is Faith McGoey. Faith is a nurse, a very successful nurse, trained at Johns Hopkins. And after 15 years of a very successful career at Johns Hopkins, she decides to move back to her homeland, Kenya. She leaves her comfortable life in Maryland to help open a maternity clinic in Nairobi. A maternity clinic that provides high-quality, low-cost prenatal care for Nairobi women, giving them a chance to have healthy and safe childbirths. Faith's commitment and dedication inspires me every day, and is the drive for our business in our search to find new approaches that will improve healthcare in emerging markets. Not too far, and this is why I'm here today, to share with you examples of where Pfizer and our partners are finding innovative solutions to improve healthcare, and perhaps also spark some ideas on how you can also make a difference. Not far from Faith's clinic, also in Kenya, I met an innovator that is using mobile technology to improve healthcare in Kenya. Believe it or not, in Kenya, 90% of Kenyans own a mobile phone. Imagine that. And Farm Access has developed and launched M-TIVA, which is a mobile phone application that allows Kenyans to save, spend, and send money specifically for healthcare. The success that we have seen in Kenya also inspires us to bring a similar program to rural China. In China, we have met with Ant Finance, who is a global finance leader that has mobile payment available for Chinese people. 600 million Chinese use mobile payment today. And we partner with Ant Finance to provide not only the option of mobile payment, but also installment payment to improve access of vaccinations in China. We're also partnering with China government to expand this program to as many provinces as possible and to contribute towards China government objective of reducing children mortality by 50% by year 2030. Continuing to think about innovative approaches to improve healthcare is telemedicine. Now, how many of you use FaceTime to connect with friends and family? Me included, although I would have hoped a lot more of you. But anyway, so yes, FaceTime. FaceTime, I use it, especially with my kids in college. And in this type of platform is allowing us to connect physicians and patients in hard-to-reach places. For example, let's think about a very small town in Costa Rica, Erida. In Erida, there are no specialists available for patients. We do have general practitioners, like Dr. Jose in this example, who uses internet to improve the healthcare of his patients. Dr. Jose today is using Pfizer's Be Connected, which is a platform similar to FaceTime that allows Dr. Jose to consult with specialists in other countries. In this example, we have Dr. Jose connecting with Dr. Maria, who is a nephrologist in Mexico. Dr. Jose provides Dr. Maria with his patient's clinical profile, and Dr. Maria provides Dr. Jose with her diagnosis and the appropriate treatment for Dr. Jose's patient. Pretty neat, huh? So now, continuing thinking about how technology can improve healthcare, we can then think about drones. Drones can help us to, again, bring healthcare to patients and physicians in hard-to-reach places. In Dominican Republic, we're partnering with NGO We Robotics and Dominican Republic Ministry of Health to experiment using drones to bring emergency medications to patients faster than ever before. We're also using drones to bring patient samples from remote areas to centers of diagnosis and provide those results to those hard-to-reach patients and physicians. Now, moving from Latin America to the Middle East. In the Middle East, we have developed a mobile game to be used by children with hemophilia in their mobile devices. This game, the Hemo Hero, allows our hemophilia patients to learn how to live healthy with their illness. The player takes the Hemo Hero through the different aspects of life: healthy eating, safe exercise, which is extremely important for our children with hemophilia, and teaches them also how to take care of potentially dangerous situations. This game, more than a simple pastime for the children, it is an opportunity for the children with hemophilia to learn how to live healthy with their illness, and is giving them the satisfaction to see that they can live a life like any other kid in the world. It is also boosting their self-confidence, their self-esteem, and their self-respect. As you can see, there are examples of many people that are finding new approaches to improve healthcare in the emerging world. And I would like you, especially when we think about the end goal that we are looking, which is to improve the lives of 5.5 billion people, We're barely scratching the surface. We need more people to help us towards this objective. And this is why I would like you to think about Faith, Dr. Jose, Dr. Maria, and all those people that are finding ways to have a significant impact. And ask yourself, what can I do to help? How can I play a role? What impact can my company have? No matter what your job is, think about how your skills and your knowledge could find innovative solutions that will improve the lives of people that need it most. Whether it is a large corporation like Pfizer, or a small biotech, or a nonprofit organization, each can benefit from your knowledge and from your skills. If there's something that my travel around the world has taught me, is that the only thing standing in the way of finding new approaches and innovative solutions that will improve healthcare in emerging markets is our willingness and our commitment to find innovative solutions. The need in emerging markets is so large that it truly does not take a lot to make a significant impact. Thank you very much for your attention.